Hi, Mike Gibson coming to you live from SCAI 2018, and I'm joined by Brian Kolski. Brian, talk to us about what we need to do with patient education in the peripheral arterial disease space.
Yeah, I mean, I think, right now we have a very high rate of critical limb ischemia, patient experiencing amputation, which, as we know, is such a devastating complication. Patients after amputation have worst quality indexes, worse than most metastatic metastatic cancers, and go on to utilize more healthcare dollars, be admitted, and have generally just a poor prognosis. So identifying patients earlier from the primary care doctor's office, patients that have wounds, and then once sort of a patient develops a wound or issues with healing, then it's identifying a vascular specialist, imaging, and ultimately, patients receiving the therapy they need to restore blood flow to the affected area. In this country right now, we're missing a lot of those patients. About 50% of patients that undergo amputation for critical limb ischemia do not undergo an angiogram prior to their amputation. So
Wow.
it's a big area for concern and a big area for us to improve on.
So what resources are there out there now for patients to learn about PAD, and how do we raise awareness on the part of both caregivers and patients?
Well, I think it's our job as primary care doctors, diabetes doctors, to be examining patients' feet. That's where ultimately the office visits where it starts. We have a lot of screening programs in place, looking at ankle brachial indexes. There's other non-invasive screenings that are pretty easy to do. A lot of the screening physical exams now include the ankle brachial index, which is a great screening tool as just a sort of baseline for patients, and then identifying the patients who are at risk: smokers, diabetics, patients with prior vascular disease, heart disease, and really trying to get those patients more appropriately screened, treated, and then hopefully being able to avoid stuff like amputation.
Great. Well, thanks for all your efforts
Sure,
in the educational arena. It's an unmet need. Thanks for joining us, and thanks to all of you for joining us here live from SCAI 2018.